Who would have thought doctors would lose their jobs? But doctors are being laid off as
Hey friends, welcome back to my YouTube channel. Please take a moment to like this video and subscribe to my YouTube channel. Like the video because it helps with my algorithm. So in today's video, we'll be talking about nurses and doctors have been laid off from their jobs. So I've put the stitches together so that you watch. I'll be back to share my true sense.
who would have thought doctors would lose their jobs? But doctors are being laid off as well as nurses. And I've been doing the research, and this is the conclusion that I've come to. The Medicare fees that were being charged to Medicare by hospitals and or clinics were so inflated and so high and had so much profit built in that now that they've been reduced and now they're at the levels where they're supposed to be, the people who wrote the budgets didn't account for this. Therefore, it's going to look like they're losing money and they're not profitable. So, like every other corporation out there, when you're chasing a number, if you're publicly traded, the easiest way to get there is to cut staff. And you'll hear these doctors say, I had lines, there was 6 months worth of appointments set up. It doesn't matter. If the hospital doesn't see the profit, the people that get cut first are those that work on salary. So they're going to have to take some time to adjust back down to where they were actually supposed to be, what they're supposed to be billing Medicare instead of the inflated numbers that were being allowed. And that is exactly why we see so many doctors and nurses being laid off, because they didn't account for losing as much profit as they did when they flipped the switch and dropped Medicare cost down to where it's supposed to be.
So I got laid off today. I'm a registered nurse. I've been a registered nurse for 3 years. I've been a home health nurse for the past year. Alongside being a home health nurse, I've also been a healthcare coach remotely. A few weeks ago, I was laid off from my second job as a healthcare coach due to Medicaid cuts. Today, I was laid off from my agency due to my client being cut from Medicaid. Mind you, this is healthcare, one of the most lucrative, job secure fields that you could possibly have. And here we are having nurses and doctors being laid off left to right under this administration. And if you ask me, this is only the beginning. If we don't do something now, things are going to get worse after this. You have groceries increase, gas increase, bills increase, unemployment increase. This is crazy. This is crazy. And
I just got laid off. I was laid off from my outpatient job and I was working in a NICU follow-up clinic. I have never experienced something like this before. So I'm doing what any sane person would do, which is I'm eating French fries, waiting to go into Hobby Lobby. I will say I'm very thankful that I work per diem. I do have a second job that I'll just pick up a little bit more at. I don't have benefits through this job, so I'm not taking a hit as much as a lot of the other nurses are, but whoa. I have a lot of feelings about this. I think the biggest one I'm feeling though is disappointment and I'm a little bit angry. This is the first time where I have seen with my own eyes that we treat healthcare like a business. It sucks because at the end of the day, the people who are suffering this layoff the most isn't me, it's not the nurses, although yes, we are suffering, it's the kids. And that's what I'm having such a hard time understanding is, why are we doing this when we know the detrimental impact it's going to have on the patients who are the children?
I got fired from my first travel nurse assignment in 2022. Someone commented yesterday on one of my videos and was like, can you elaborate more on what happened? And I would love to, because I use it as a cautionary tale to any nurse, anyone who is filming in the hospital. I was just watching the video of the nurses pushing a nurse in a Hoyer lift down the hall, and it was to like a Mean Girls audio. And they're all probably like the best nurses, but that doesn't matter. All that HR or higher ups are seeing is that you are using patient equipment and you are goofing off on company time and then posting it on TikTok. So it's 2012, I'm working in ICU. At the time I had no patients, and this was like a trending audio to write your name on a whiteboard to put it under like RN, CNA, PT, OT, food services, because COVID, we were so short staffed, we literally did it all. So I was just doing a trend. I had no patients. The room was completely clean. The video goes viral and I start to notice people commenting, that's blank hospital, or some people saying, oh, I know that hospital is whiteboard anywhere. A couple of people are like, what floor do you work on? I'm still thinking nothing of it because all the comments are really positive. But yeah, someone took that video and sent it to a higher up of that facility. It went above my manager. She couldn't even stop what was happening. And my recruiter called me, I think the next day or something. It was my friend's 30th birthday that I was planning. And my recruiter called and was like, you've been terminated. And all she said was that it was a TikTok. And that TikTok was just a whiteboard. And I don't even think it said the hospital. People just picked up on the hospital based on the colors and the font of the whiteboard. So do with that what you want, but I will say I do not think a trending TikTok is worth your job. I was beyond mortified and embarrassed.
Let's talk about how I almost got my ass whooped by a patient, but I'm the one lost my job, right? So this is going to go back to us doing our due diligence, you guys, and being very, very mindful of the opportunities that we accept in our life. I was so excited, you guys. I was a brand new MP. Everybody was getting out of school saying how hard it was to find a job. I mean, I had found a job within about 4 weeks of looking, so I felt like I had hit the jackpot. Lord knows, honey, baby, that shit, I was raw, baby. It wasn't no jackpot. But long story short, I had seen a patient on this one specific day. I'll never ever forget it because this was like a first time I had a very traumatic event that happened to me. The patient was requesting a controlled substance. This specific facility does not allow their mid-levels or NPs or PAs to write controlled substances. You put the order in, you send it over to your supervising attending, and they approve the controlled substance. The patient was aware of that, but he had already came in when his medication was out, and so it was no way that we could expedite the controlled substance until my supervising seen it. I did call her. I shot her a quick text and was like, hey, I got a controlled substance coming your way, and that was it. And the reason I say I had all the red flags were there, you guys, I should have paid attention. I only got 6 weeks of training being a brand new MP, and then after that time I was shipped off to a brand new location with a brand new building in there by myself. And when I say by myself, it was not another MP in there with me, not another doctor. They had another psych MP on a whole nother section, and they had a dental service in there. I still ain't thinking nothing about it. I was so excited. I just knew I could do this. Okay. So the day in question, when the incident happened, we was in the building all by ourselves. It was me and 2 MPs. It was actually afternoon time. And now granted, we would have, I'm sorry, let me take that back. I said 2 MPs. It was 2 MAs. Sometimes I would have 2 MAs. Sometimes I would not have 2 MAs. It was me and 2 MAs that day. One would sit at the desk, one would room. So it was me and the girl rooming. The patient got in there. I advised the patient of the process. When I went to stand up, the patient pinned me to the wall. When I advised him that he would have to wait for the controlled substance to be refilled, he pinned me to the wall. So I yelled out to the MP. She heard me telling the gentleman, please get off of me now. You better get off of me. Like, get off of me now, right? I didn't know what else to do. I had never been in an event. And granted, I come from an ER and watch plenty ass whoopings, but I had never been in an event to where it was me now. So the MA ended up running in there. We had finally got the patient to de-escalate. So I thought it was over. The patient was escorted out. End of the story, you guys. I reported the whole chain of events. 2 to 3 months happened. 2 to 3 months go by, and the patient is back on my schedule. I refused to see the patient. I was like, I cannot see the patient in this facility by myself. I do not have any protection, any coverage. I'm here all by myself. It was me and just one MA at that day, on that day. And I refused to see the patient. To be continued.
I just got to vent real quick. So today is the first night that I've ever been fired by a patient. I came in and got report, and then, you know, sometimes you'll get report that, hey, just watch out for this patient. So I'm like, okay, some patients, you know, you got to cater to them. And I guess I'm just used to this type of environment that you really got to cater. Like, so I came in with the mindset, that's fine, I'll cater. Like, whatever you need. Sometimes patients treat you like, they treat you like a maid. I don't understand, like, what kind of health, what is this? Like, I'm not your maid. And it's like, I can't get nothing done if I am at your hands and foot. You might as well only have me as one nurse if I'm going to be your maid like this. So I stayed in there with the patient, and because of all the requests that they're asking for, I'm going back and forth. So now to her, I'm incompetent. It's like she has to direct how to be a nurse. That's what she told the charge nurse. And I don't know why, but that really hurt my feelings. Like, lady, like, I really was there for you. I know people will be like, girl, it's fine, or whatever. And then I was backed up the whole night, and that just stayed on my mind. And when I see, and I'm the type of person, I like to go apologize, but the charge nurse said, don't even go back in there. Like, she said we didn't vibe, or she didn't connect with me. And I don't know if I was wrong. She asked me how long I've been doing this, and I told her this was my first day. Maybe I shouldn't say that. I know my coworkers has told me before, Jessica, stop saying, but I told her I wasn't new to, my job or whatever. So she told the charge nurse maybe that was it. But I saw the husband this morning, and I said, I just want to tell you I'm sorry. Like, I'm not for sure what happened, if I offended y'all. And he was just like, it's basically, it ain't you. And I was like, okay, like, but it's like, man, like, the more I become a nurse, and I'm still a real, like, new, I ain't that new, but I'm new, versus, like, man, people take healthcare like a whole not like this a hotel, and then get mad if you're not at every single, yes ma'am, yes sir, I'm trying, I got 8 other patients. And I was getting my ticket because it's just alone. I'm just not getting off work. It's 10 o'clock just now, and I'm just leaving out crying. And then I don't know who that lady was, and she just said, thank you for your services. I'm like, oh, man, thank you, but I gotta learn, like, gotta stop letting these patients get to me, because after that I got fired. It just made me want to switch. Is it how I talk? Because I can't fake being no fake bougie. I can't do it. I can be like, I don't know. Maybe I'm just tired. It was a rough night, and I appreciate like morning shift nurses that understand. Hey, dude, I had a rough night. There's some nurses like, okay, they just lazy, but when the ones that say I had a rough, I'm not done nowhere near trying. It was like I wasn't even there, because I just stayed on my feet. Have y'all ever had a night that is just burning down? It's burning down. The London Bridge is burning. And for them morning nurses to be like, it's okay, I got it. I appreciate y'all. Like, I would have been here for, I don't know, I've already been here since 10. I'm going to eat Fruity Peppers and go to bed. Y'all have a good one.
I literally got fired from my job during Nurses Week. So yay, I love being a nurse. But for some context / background, I'm a travel nurse. I had just accepted a travel assignment. Well, not just. I had been planning on doing this travel assignment for about a month now. We're about 2 weeks out. And I got the call yesterday that my contract has been canceled. So I have no job now. I basically got fired before I even started at this job. And I even worked in the same hospital system in LA previously before accepting this job. And even on my last shift, I was, out of the kindness of my heart, I worked a 20-hour shift. I literally worked 8 hours overtime because they were short-staffed. But you know what? Hospitals really don't care about you. That's what I've learned from this. They could care less if you're a good nurse. They just are about their money. So happy Nurses Week.
So I was just laid off. I've never been fired or laid off before. So instead of waking up at 6 o'clock in the morning to get ready for work, I took my dogs hiking this morning. They're pretty stoked I'm laid off. They're enjoying this. Now they're pooped. I have no idea what I'm going to do. I have no plan. My normal reaction right now would be to be freaking out and scrambling, but I'm not. If anything, I am at peace, and I just feel relieved. And it just goes to show how toxic some of these work environments can be. I don't think I would have quit. I think I would have just kept pummeling through day to day, waking up every Monday, just counting down the days, the minutes until Friday afternoon so I can breathe for a second before it all starts all over again. And I've found myself on this side of TikTok recently with people talking about how toxic these 9 to 5s can be, or whatever, not even, whatever your job is, working for someone, how toxic it can become. And we all know the job market is just garbage right now, so that's fun. So I have no idea what I'm going to do. I can't believe I'm not freaking out. So I am going to create a series. Follow along. Let's see how this journey goes because I have no idea.
That's a video, friends. So I'm just here just to add on like what I think about today's video. So it's becoming more and more shocking to see what's happening in the healthcare industry right now. Nurses and doctors, the very people we clapped for during the pandemic, the ones we called heroes, are the ones facing layoffs from their jobs. It almost feels like unreal because for years we are told that there was a shortage of healthcare workers that was desperately needed more hands on deck. The hospitals were overwhelmed, and now many of these professions who dedicated their life to serving others are suddenly being told they are no longer needed. The reason behind these layoffs are laid very complex. Some hospitals are struggling with budget cuts, others are merging with large health systems, and some are simply trying to cut labor costs. But when you think about the human cost of these decisions, it's devastating. Nurses and doctors have been spending years in schools, racking up debt, investing in their careers, and putting themselves on the first line, especially during the pandemic. Now they are facing job insecurity in the field that we thought was one of the safest and most stable. And the truth is, healthcare systems are being run more like corporations than care facilities. It's about numbers, profits, and bottom lines. When hospitals say they're losing money, the first cut often comes from staff, even though it's the staff who actually keep patients alive. Many administrators are still earning 6 or 7 figures, while the people in the scrubs, the ones providing direct patient care, are being shown the door. It raises serious questions about priorities. Are we putting money above lives? Patients are also the ones who will feel the ripple effect of these layoffs. We fear that with fewer nurses and doctors, workloads increase for those who remain. Burnout rises and mistakes become more likely. And wait, time gets longer. Healthcare is already stretched thin. Cutting staff only makes the system weak. It's not just about the people losing their jobs, it's about the quality of care that everyday patients will receive. And let's not forget, many communities already face doctor shortages. Laying off professions in those areas is direct hit to the people who need help the most. On a professional level, this is heartbreaking. Imagine spending 12-hour shift on your feet, working through holidays, missing family milestone, dealing with trauma and lose every single day, and then being told you're terminated. Many nurses and doctors are feeling betrayed. They sacrificed their healthy and their time, and now instead of stability, they're facing layoffs. This is a wake-up call that even so-called secure careers are no longer guaranteed. It also makes young people question whether they should even go into healthcare. For decades, being a doctor or a nurse was seen as one of the most reliable professions. But if the system is laying off the very people it once claimed it needed, desperate, how can anyone feel secure about investing years of education, training, and debt into the career path? We also need to look at the bigger picture also. Healthcare costs keep rising for patients. Insurance companies keep making billions, and yet somehow hospitals say they don't have enough to keep staff employed. These are disconnected here that can't be ignored. Someone is profiting, but it's not the sense, it's not necessary, it's not the doctors, and it's definitely not the patients. These layoffs reveal a deep crisis in our healthcare system. It's not just about one hospital or one state, it's about different places across the country and even around the world. This highlights how broken the model really is. A system that doesn't value the frontline workers in system that eventually collapse. Okay. So the sad truth is when we strip away the titles and the scrap, these healthcare workers are human beings. They have mortgages, student loans, our children in dreams, just like anyone else, and yet they're being treated like disposable as part of the machine. That should concern all of us because one day we all need healthcare, and if the people trained to save us are not there, will feel the consequences. This is not just about healthcare story, it's about priorities, economics, and humanity. It is one that deserves more attention because if heroes of the pandemic can be discarded so quickly, what does that say about how we value work, service, and human life in our society today? So, guys, that's a video for today. Thank you so much for watching. I'll see you in my next episodes. Bye.